A really common complaint on the gym floor is that people, when they're squatting, get what is known as an ankle impingement. And it's this blocking pressure feeling at the front of the ankle as they go down into a squat movement. Now, there is a reason for this. In society, we do not use our feet and our hips the way that they're designed to be used. What ends up happening is we get locked into hip flex position because we're sitting all day, and then we don't get that full extension in the hip, which means that our foot, we have to lift rather than actually creating that energy and that movement forward with our hip, our knee, and our ankle. We start to build up a lot of tension in the front of the leg here. We're gonna have a look at Joe. He has great ankles, but we're gonna have a look at how to test his strength around his lower body, functionally up against the wall, and then out in the gym floor, how to work with it. Now, when you've got someone on the treatment table, even pushing up their toes towards their shins like this, if they've got an ankle impingement, you're gonna start to feel this bitey sort of blocking feeling here. He's gonna push down into my hand. Now, a lot of strength there in his soleus, a lot of strength there in his calf. So his lower limb is actually super fine. Now we're gonna use a knee to wall. Not a great test for anything other than testing if he gets an ankle impingement. And the goal of this test is essentially to push the knee as far to the wall as you possibly can, whilst keeping the foot in a straight position and your heel in contact with the ground. Someone with an ankle impingement will already be going like, I've got a lot of pressure in the front of my ankle here. It hurts. I don't feel any stretching in my calf. What you want is a normal stretch pattern where you're getting a really nice stretch on the back of the ankle there. So that's what we're chasing. But in an ankle impingement, you will not have that sensation. You'll be blocked at the front. So let's go out into the gym floor and have a look at how we can fix it. From a treatment standpoint, it's quite hard to access the front of your ankle there. So getting some treatment in the treatment room from a physio or chiro is really helpful. You can use trigger point stuff or this tool here, like a stick that basically softens up that tissue. We're opening up the front of that ankle, and then I'm gonna get Joe to sit back onto his ankle. Then from that position, we wanna get it into a standing position where we start to traction the ankle a little bit. I would sit here, do both sides. You can even sit on both ankles, lean back a little bit. Now this here, for someone that has an ankle impingement, will allow them to actually access the calf and start to get a little bit of a stretch in the back there. So fantastic drill just to open up that ankle a little bit. Now say you've worked through some of that mobility-based exercises, you've got some trigger point in there, or you've had some treatment from a practitioner, you can start to link this all together and actually then start to train the calf itself. You don't need any fancy equipment. You can literally do body weight. We're gonna do high reps here basically. So say 15, 20 reps. We're not gonna show you all now. And that will hit the lower portion of the calf. And then he's gonna straighten out his knee and he's gonna do calf raises in a straight knee position. Now that's gonna hit the gastroc. So this is the bigger calf one that wraps on the back of the knee. Now that is a really good integration. We've assessed that there's an ankle block, we've treated the ankle block, and now we're adding strength into the back of it. If you're getting pain at the front of your ankle when you're squatting, give this a go. Release the front, mobilize the ankle, and then start to strengthen up the back side of the calf. It's a game changer.